Okay, let's talk about enhanced recovery after colorectal surgery. I'll preface this by saying that when I was a resident training to become a general surgeon, whenever we did surgery to remove somebody's large intestine, they got a ton of IV fluids. They stayed in the hospital for a really long time. They got a ton of narcotic pain medication. They were instructed to, get out of bed, maybe post-op day 1 or 2. But, it was like a long, lengthy process. People would stay in the hospital for 7, 8, 9, 10 days. They would have tubes in their nose, tubes in their bladders. We have now seen that none of that is really necessary for the recovery from colon surgery. So there are now internationally accepted enhanced recovery protocols to get people recovered from colorectal surgery faster and out of the hospital faster, reducing risk of complication. So what goes into this enhanced recovery? It actually requires people to do something 3 days before surgery, the day of surgery, and then immediately after surgery. So it is a multi-setting protocol in order to reduce the risk of complications postoperatively. So the first thing we do is we actually start pain control 3 days before your surgery even starts. The data shows that if we can hit some of those pain receptors preoperatively with a non-narcotic pain medication, your pain postoperatively is better controlled. The day before surgery, we give people a bowel prep to clean out their large intestine. We also give people 3 doses of 2 different antibiotics to also sort of clean the bacteria out of their large intestine. These 2 measures have been shown to lower the risk of postoperative infection after colorectal resection. We also give people a shake that they drink. It's a pre-surgery shake. And what that does is it helps their blood sugar stay steady throughout the case. That has also been shown to lower the risk of infection after surgery. Now, during the surgery, the patient gets minimal fluid to reduce all of the tissue swelling that happens after surgery. If the patient is diabetic, they get their blood sugar checked every hour throughout the surgery to make sure there are no spikes in the blood sugar from the stress of the surgery. Immediately postoperatively, all tubes are removed. So tubes in the nose, tubes in the bladder, all of those are removed before the patient wakes up from surgery. Postoperatively, patients get a multimodal pain regimen. What does that mean? That means they get several different types of non-narcotic pain medications that hit different receptors so that their pain is better controlled. And then if there's severe pain on top of that, they can get a narcotic pain medication. But this multimodal pain regimen has reduced immensely the need for opioid pain medication, which tends to slow down the intestine postoperatively, leading to longer hospital stays post-op. Patients may also get a nerve block either before or directly after surgery. And in the recovery unit, in the PACU, patients are to be sat up in a chair in the recovery unit before they even go to the floor. What this does is it gets patients actively up and moving, so it lowers the risk of blood clots, lowers the risk of pneumonia from that shallow breathing that happens when they're laying in bed. The other thing that we used to do is we used to starve people essentially until they started passing gas. Now we give people regular food right in the recovery area. If we do all of these things and we're able to use small incisions, some people can even be discharged home from the recovery unit. Some people are admitted for 1, maybe 2 days post-operatively. If their pain's controlled and they're eating or drinking without problems, they're ready to go home. So the days of tons of fluids, drains everywhere, narcotics everywhere, lengthy hospital stays, those days are over. And patients' infection rate has gone down, complication rate has gone down, and satisfaction has gone way up. And we do this without compromising cancer care. We do this without compromising quality of surgery. So while it is a major abdominal surgery, it does not require a major hospital stay afterwards.